Today is the 1032nd day of the uninterrupted daily webinar of IFPH. And today we are having as our guest, Dr. B.R. Bindu, lecturer, Department of Organon of Medicine, doctor in charge of Neuro and Neurodevelopmental OP, Sri Vidyadhiraja Homeopathic Medical College, NEM. She's a homeopathic doctor with more than 20 years of teaching and clinical experience, specialized in neurodevelopmental research and a passion to serve the community at large. She took certification from Council of Homeopathic Certification, USA, was a resident member of North American Society of Homeopaths, served as extension faculty in American Medical College of Homeopathy, Arizona. She took PG diploma in management from National Health and Family Welfare, New Delhi. Have presented scientific papers in national and international conferences. And now she's pursuing PhD in homeopathy from Kerala University of Health Sciences. I proudly welcome Dr. B.R. Bindu. And the subject is scope of homeopathy in neurological disorders. Doctor, welcome to the session. Welcome all.
Good morning. Shall I share the screen?
Sure, you can. You're a co-host now.
A disclaimer, I would like to start my session. That I have obtained informed consent from all the patients and caretakers for displaying their audio and video during the presentation. First case is mad cow disease, that is Creutzfeldt-Jakob disease. Hope you all know that is Prions disease.
Ma'am, volume is very...
Can you hear now? Is that okay?
You can continue. Yeah, please.
So first case is mad cow disease. You know, it's a very rare condition. Prions disease, also known as Prions disease. And this was already diagnosed case of Prions disease. You know, it's written in that is Creutzfeldt-Jakob disease. And the patient was in coma when I first met him. This was the condition. You know, in Creutzfeldt-Jakob disease, there will be myoclonic seizures. You can see the myoclonic seizures. And I visited the patient there and took the symptoms. And this was the follow-up after. And this was the follow-up after around 3 to 4 months of treatment. And this was an audio, sorry. And the medicine was given was Veratramel. First, it was given through oral route and oral fraction also. That is the criteria for selection. You know, in homeopathy, we get symptoms. How can we select the symptoms in a coma patient? Mostly, here comes the importance of observational symptoms and the objective symptoms, because in coma patients, we don't get many symptoms from the patient. So we have to collect from the patient's bystanders and also from the from observation. So I visited that place, and when I took the case history from the wife, I heard that he was a chartered accountant, he was working abroad, and suddenly he had some issues with his memory loss and some other mood problems and all. Then he came back to the native, that is in Coimbatore, and they came and went to Apollo Hospital. He went walking only, and from after doing observations daily, doing in 1 week, he ended in coma. So you know the progress of Creutzfeldt-Jakob disease or mad cow disease, it suddenly progresses into coma. The first changes, and I asked her about his condition before he went into coma, how he was, and from the history, I came to know that he was otherwise a calm patient, but suddenly he developed mood changes, that he started abusing him, and he was very particular about keeping things in order and all. And regarding his generals, when I asked here, she told me that he likes lime water, And he is a very chilly patient. And from the observation, I noticed that there was few that sweat over the forehead and on the above the nose. So that guided me to the selection of Varatramal. And based on the totality of symptoms, I gave him Varatramal. It's due to the pathology, increased pathology. I gave him, started with the Varatramal 6C. So I advised the patient's bystander, that is his wife, to smell it through the nose by soaking the 6C in cotton, and repeatedly smelling it through both nostrils by holding one closed and smelling it through the other. Like that, continue for first half an hour for 5 minutes, and also give diluted dose like 6C in 15 ml and diluted adding 3 drops in 15 ml. That is 1 drop in 5 ml, like that. I diluted that, and then told her to give 2 drops every 5 minutes for first half an hour, then make it half hourly and 1 hourly the whole day. Then changing it to 3 hourly the next day, and then the day after, the third day onwards, 4 times daily, and keep me informed. And she used to call me every 2 weeks, and from the first week itself, the jerking was limited, and they saw some blinking on the eyes and few changes were there. And she used to send me the pictures and photos, that videos of the patient. So he was improving slowly, and lately, like after around 6 months, and he sat, and his tracheostomy tube was removed, and he started slowly eating orally. But so that was the first case, and that is the case of mad cow disease. So by all these cases, I am here, like I would like to present that even though these cases are, it's all not completely curable. Most of the neurological cases, we can't claim a cure, but at least we can improve the quality of the patient. So that is my aim in presenting all these cases. So now, this is another case, like multiple arteriovenous fistula brain. And this is a case came to the OPD of Government Homeopathic Medical College, Trivandrum, when I was doing PG there. And that case is, you can see the multiple like arteriovenous fistula all over the brain. It was like this, and the whole face like little bit of edematous, and they have done many times that electrically they have done the electrically destroyed that fistula, but again bleeding occurred, and so they stopped that and came to the trying homeopathic medicine. And she was affected with hemiplegia also, and she was not like able to walk at least 100 meters, and she was at that time, I think, 23-year-old. And when I took the case, she told me that when I asked her about the generals and all, while the process of case taking, when I asked her about the details of case taking, she told me that I don't have any desire, like what food do you prefer, and what you like to drink, and all those details. Then she told, doctor, I don't have any desire. I don't have even a desire for living, because all my friends of my age are married, and they have kids and all. So how can I be happy, or in what hope I should strive? And she told me that when I took the history, she told like she was a very brilliant girl, and it started when she was in the 9th standard as a single fistula in brain. Severe headache was the presenting complaint, and when they did the MRI, they noticed 2 arteriovenous fistula, and slowly it progressed to 9, 18, and so on. So, people from Sri Chitra Institute, they told that there is no scope. Anytime it can rupture and it will cause the death of the patient. So her mother was a nurse in General Hospital, Trivandrum, and she also asked me whether there is any hope. So I told her that I can't guarantee any hope, but let us try and see how it improved in 3 to 4 months. And she started walking 100 meters by holding the handbar of the near the IPD in Government Hospital, Trivandrum. So I was so happy, but unfortunately, that mother was taking care of this daughter a lot, and the father was complaining about that he is not getting enough care from because of this girl. Why can't she put her in an orphanage and all? By hearing that, her BP shoot up and it ruptured the arteriovenous fistula, and she died. So, but by showing this, these type of cases, we can do wonderful, we can get wonderful results. And the medicine given was Aurum Met. You know that from the symptoms I have narrated, it's clearly indicated Aurum Met. And that also, again, I started from 60 and reached up to 200 potency. Now, the third case is a post-traumatic quadriplegia. This was a case came to our OPD in Sri Vidyadhiraja Homeopathic Medical College. And he was a 30-year-old male and who had a fall from 15 feet height from the steps because he was drunken, and that he got admitted in tertiary care and diagnosed traumatic quadriplegia. And there was C3 to C5 nerve concussion also was there, and C3, C4 concussion was also there. So this was the condition when he was admitted in our IPD, and he was with this urinary, no sensation from him downwards, and also he can't raise his arms and all. But he was very alert, he can talk. So you know that C3, C4 concussion, usually it causes quadriplegia, limited movements of, and no movements of, no sensation of bowels and urine. And first day I gave Staphysagria 1M because there was repeated, when he was admitted in our hospital, they told me that he is having repeated urinary infection after this catheterization. So we have to remove the bag every 3 days. Otherwise, it will cause a reverse reflex and may cause infection to the kidney. So that made me think of Staphysagria and gave Staphysagria 1M. And the second day we removed the bag, and he started sensing the urinary reflex, and he got sensation, and so we removed the bag. And then after, within 2 months, he started walking. See, so with the help of physiotherapy and the medicine, he started walking. And the medicine given was Hypericum, none other than Hypericum. That you know that spinal cord concussion is an etiological, it was an etiological prescription, that Hypericum. Because of his, even though there is spinal cord concussion and his mental symptoms and all was clear, generals were otherwise better than this loss of sensation and of bowels and urine. I selected 1M potency, and 1M repeated dose I gave as an thinking it an acute emergency. So repeated 1 hourly in diluted dose, 2 drops 1 hourly, the first day, second day 3 hourly, and then third day onwards 4 times daily and then stopped. And after then we gave only blank pills, and after that he was discharged with the 10. And this is another case of hemimegalencephaly with symptomatic West syndrome and hemiplegia. So you know that hemimegalencephaly is one side of the brain is full of like water or empty. The child came to me at 2.5 years of age, and she came. When she came, she was not able to hold her head high, and she had, you know, that symptomatic West syndrome. There is continuous seizures. That continuous seizures, like 80 to 100 seizures, irrespective of taking 5 anti-epileptic drugs. She had 80 to 100 seizures a day. So at that time, the parents, like from Sri Chitra, that to Sri Chitra Institute, they went there, and the neurosurgeon told they can only reduce the seizures by cutting the commissures, cerebral commissures. If they cut the cerebral commissures, they can reduce the seizure. But when they asked about the general improvement, they told that they are not God, so that they can offer any change. But they came to me, and it was referred from by my brother, and that case came to me, and they asked me whether we can do something. I told, let us see, because we don't know. This is the first case I am also treating, and I don't know how it goes and all. And I started the case with 200 potency here, because the medicine was given. Medicine given was carcinosin, so I hesitated to give the low potency of carcinosin because it's a no sort, and it reduced to 2 anti-epileptic drugs with less than 250 seizures. And she started responding to the calls of her father. He was abroad, and she used to, whenever the call of her father comes, she moves herself to get the call of the father and show emotions. She started showing emotions and all. This was at the beginning when we started medication. And at first the seizures was grand mal seizures or generalized seizures, and later it turned to absent seizures. So in my observations, when we treat epileptic cases, majority of the cases, when first the change we obtain is the generalized seizures will come down to absent seizures or simple absence attacks. And this is the improvement. And in that case, like she used to give me, like her left side hands and left leg was paralyzed, but she used to give me a flying kiss from the left hand when she last came to the OPD. And the fifth case is a case of spinomuscular atrophy. You know that SMA is a highly like very rare condition for which there is no cure possible as far as we know. And but in the 4 varieties of SMA, this is a case of SMA3, comparatively milder variety of SMA. And in this case, the child is the SMA3 usually presents at an age of adolescence. From 18 months to adolescence, it can present at any time. The child will be having difficulty to walk, and he will be having difficulty to climb steps and all. And this, as all other cases, this boy presented at 15 years of age. He started falling in the school repeatedly, and the teachers informed the parents about his repeated fall in the playground. So they took him to the hospital and have his investigations done and diagnosed SMA. And then only they knew that his father is also an SMA patient. And he found it difficult to rise from the sitting position, and there was very severe pain. There was severe pain in leg while he's tried to climb the stairs, and there was recurrent attacks of fall. That was the presenting complaint. And this was the diagnosis made by the hospital. And on totality of symptoms, I took these symptoms as but the others are all common symptoms. As Hanneman said, we should avoid all the common symptoms of the disease. And so in my prescriptions, I mostly rely on the generals or the individualized symptoms. So here, when I took the case, he likes raw mango and icy cold drinks, and he doesn't like covering, and he always prefer to lie on Nietzsche's position, and he doesn't have any fear. He used to play with fire, matchstick, lighting the matchstick and touching that and all. He used to play with the matchsticks and all. And also he was teasing his sister and all. Taking all these things into consideration, I selected medorinum as a medicine and started with medorinum 6C, and it went up to CM potency. The repetition based on the second prescription criteria of James Taylor Kent. I usually follow the second prescription criteria of J.T. Kent. And now he can walk without falling, and he climbs stairs without much pain. And so the parents are happy, and I'm also happy, but we don't know how it goes as years passes. And coming to the last case, that this is a case of neurological issues. Sorry, not last case, last but one. This is a case of neurological issues from kyphoscoliosis. You know that kyphoscoliosis is a condition from birth itself. The child had was on braces, and he undergone many surgeries, and yet he found it very difficult. Like, he was diagnosed with kyphoscoliosis at the time of birth and underwent many surgeries, and he was bedridden for some time. And then when he came to me, he had a recurrent attack of UTI, and especially when the pain during urination, and it will pass in drops after holding the urine for long. And another thing is that he had weakness of legs. He doesn't have much sensation in his legs. So he came with the support of his parents, with the help of walker, and it was very difficult for him to travel. He came from the northern part of Kerala to Trivandrum, and it was very difficult for him to travel. And weakness of leg, especially during the first motion, and there was a pain in thoracic spine and sitting for a long time, which was aggravated more during a warm application. And this was his history when during discharge and all. When the totality, he can't tolerate hot weather, and he has a desire for fish, and sweat of palm and face. And in mental symptoms, I got this symptom that he doesn't want to argue with people and try to avoid conflicts in any form. And if at all hurt by anyone, he is forced to keep distance from them, because he doesn't want another conflict to occur, or he doesn't want to hurt him. So that was a key point. And I selected Natum Muriaticum to started with 200. Since the generals was promising, I started with 200 potency, and now on 10 second dose. And now he travels alone with the help of a tripod and without taking his parents along with him. And now he can stand easily and all. Second, let me try to. There was an audio of that patient. Unfortunately, I was not able to upload that. And this is a case of autism. The last phase, actually, now I am treating around more than, this is my area. I'm more confident about. I have treated more than 250 to 300, around 250 to 300 cases of autism, both from India and abroad. And the cases ranges from 2 to 3 years to 25 years. I'm having patients. And I have put his name in like an alphabet K. Like he's actually, one documentary was released recently showcasing my 7 cases of from my case stories by a director. And this boy played the key role in that documentary. So this was like, I will start recording, I will take the video, usually record the video only after a few visits, because no, you know that the parents are coming to us without any hope. So it's very hurtful if we start taking videos when they come with their worries and all. So I usually, after gaining their confidence only, I will take the videos. So this was in the beginning. And in this case, the child was completely mute when we started medication. He was not talking much, and the parents were abroad, and the mother was a nurse, and she took him to the pediatrician there, and she told the physician that she has doubt that her child is having autism and all, and that physician also told, or that pediatrician also told that there is some doubt for him also, because he is not keeping eye contact or not responding to the call and all. And they came to the native, and they went to one hospital, and there he was diagnosed with autism, moderate autism, and with started speech therapy. And that on starting speech therapy, he started uttering few words like amma, appa and all. But that too not looking on their face. And he is not responding to the call, and he is not identifying the surroundings and all. He was always roaming around. So they were very disturbed. And when we started medication, now he is in a normal school. Now he comes home in Saudi also. He used to come home alone after tuition, crossing the roads and all. So the mother is happy, and now they are settled in Kerala, and he goes to a government school here, and is singing national anthem in the assembly, and now he's a leader there. And this was his presenting complaints. He doesn't speak in sentences, and there was poor eye contact. And licks his palms when angry, and there was biting nails. And he used to eat paint and sand, makes sound for his needs, and he was very hyperactive, and there was some thumb sucking and social interaction. The surprising thing is that that in autism, the child is always deficient in social interaction. But this boy, he will come to us, or he will go near the other, whoever comes home and all. He just goes near them, but don't talk or don't listen to them, or he will be always in his own world. But he goes and sit near the persons. And so that was his social interaction. And there were repetitive movements like other autistic kids, and he will not eat by his arms, and he will not chew also. At that time, he was not chewing food and all. Till 1 year, in the history, till 1 year, he was normal. He was a normal child, like all the milestones were normal. And he started like, he used to play and 1 or 2 words were there. And after 1.5 years only, it regressed. And that made the mother confused and think of autism in her child, and took the child to the pediatrician there. And the main totality of symptoms I took was he desired spices, sweets, and salt, and he prefers covering and fanning, and he likes to take the cold water, cold drinks. And bowels were difficult to move once in 2 days and all, and sweat, especially in hand. And I selected, because the striking symptom I chose, the main symptoms was like desire for the salt, and icy cold drinks were there. And also what struck me was his social interaction, because in an autistic child, usually we don't expect social interaction. The social communication and social interaction is very less in autistic children. So this is an uncommon rare symptom which I took for the selection of this medicine, and the medicine was from phosphorus to CM. Now, whenever he has any acute complaint, now I have almost stopped his medication, and whenever he has any acute complaint and all, the mother used to call me and I send medicine. So this is it. Sorry for late playing.
What happened after Bindu? Don't worry. We can go to a discussion.
Okay, so he was narrating like how he felt before when he came, how he was when he came to came for consultation, and how he improved and how he is traveling after taking the treatment. So that's all from my side. Open for discussion, and actually my aim, I think my aim is served, because my aim was to highlight that in these kind of cases, if we can't give at least cure, at least we can improve the quality of the patients. Don't hesitate to take the case and move forward. We can do something or other, and we can help them out to live a better life from like in each and every case. And one thing is that if we can't cure also, at least we can see the happiness in their face of having a better quality of life and all. But be sure that we don't assure them that we can cure or miracles will happen with homeopathy and all those things. But with limited hope, we can give them limited hope that let us see what can be done. And all these cases, the thing is that they all improved in their immunity, and in all the autism cases, in most of the, like in more than 90% of the cases I have treated with seizures, they all they have reduced in their seizure attacks in intensity and frequency, and most of them reduce their medication also. So that is a wonderful thing, that in all these neurological cases, don't hesitate. Don't think that we cannot do anything. At least try. Can try something. Let us give a hand for them to have a wonderful, like better quality of life. Thank you.
Thank you, Dr. Bindu. Excellent case presentation, and it is really motivating. Though some technical glitches in audio was there, your cases was speaking louder about the things which you are doing there. It's great. So it's a time to interact with the speaker. And first we are having Dr. Manoj with us. Dr. Manoj, please.
Thank you, Dr. Binduraj. No doubt about that. Dr. Bindu, we are really wonderful presentation. All this happened or possible. Why? Because she acted as unprejudiced observer. Without any pride or prejudice, just go to the case. What is especially in this case of disease, not the case, but case of disease, where she succeeded. Whether this will cure this disease or it will act on the neurons of this, that area, this organ. No, it is acting on the individuals. That is the most important thing. Wonderful presentation. And by I am myself and Dr. Bindra, we are alma mater of this institution. So definitely we'll be more happy to hear from Dr. Bindu such a presentation. And also another thing is that her father was a professor in Trivandrum. So that is the ease of presentation. That is also remarkable. Moreover, she did more qualified, not stopped after the PG courses. That's another important thing. That is also a true lesson to all those who are participating in this program, as well as the homeopathist. Most important thing. But a request from me is that you must give English subtitle to your documentary, so that our international viewers, they can understand.
It has subtitles.
Yes, pardon?
It have subtitles in English.
Yes, definitely. So we will definitely share in the international and national group in the coming days. No problem about that.
All the cases are severe autistic cases.
Yes,
all of them are severe, not, and that too above, most of them are above 15 years. Few cases are 15 years of age and above that.
Yes. What is more important the management supported. The manager of the college is a cardiologist. That's an important thing. He did supported it. That's the most interesting thing, especially when you're considering the situation in Kerala. Isn't it, Dr. Bindu? Am I right? We are muted.
Sir, like I would definitely mention that, because without their support, I can't do anything. Because after I took my dissertation topic as autism, and after completing my PG, when I came to the college back, and I approached the principal and the manager for starting an OPD in my college on neurodevelopmental disorders, and they wholeheartedly encouraged me. And the next Tuesday itself, I started the OPD, and now it is going smoothly with all their support. I can't, not even a single principal or from the management. And the principal, she's always with me in all, not only with me, in all the research activities and all the innovative projects. And along with the principal, the management also joining hands. So that is promising.
I can feel the transformations for the last 20-25 years you did made, because these students, these fellows were seated as students in my front. So I am very, very happy, double happy in seeing you. Thank you, Dr. Bindu.
Thank you, Dr. Manoj. And next is Dr. Hariharan.
Hello, Dr. Bindu. Bindu, congratulations. I know that autistic children's 100% it will be, we will get the improvement by homeopathic medicine. I'm sure about it, because I had now I had see about 5 cases improving by this homeopathic medicine. One boy is studying now at 8th standard. One boy is studying 6th standard, and the 8th standard child has got selection for some national computer this thing. He has got selection. Yesterday he came to me. They have very much happy, and I am also happy by seeing him. That is, his name is Arjun Patel. He is now studying at Kayangulam. So We can do a lot of thing in this field, but we must have the support of audiology, speech therapy, and physiotherapy. See, these three things must also include while we are treating for autistic childrens. See, okay, very good. I am proud of you. Thank you very much. Okay, good night.
Thank you, sir.
Thank you, Dr. Hariharan. And next is Dr. Ranjit.
See, screen sharing is not stopped.
Dr. Ranjit, next is Dr. Ranjit. You can speak.
He is not responding. Maybe network problem or it has accidentally happened.
Okay. So we are so glad, and your video is now viral. I think within a few days after the release itself, it's going viral. And we are all proud on that, because this type of thing is making homeopathy reach more to the heart of a lot of other persons, because this autistic cases is not that easy to crack with other things. And in that video itself, or on that learning itself, you are just mentioning that we need a teamwork for that. We need speech therapists, psychologists, and along with that, the intervention with good homeopathic medicines. The rehabilitation is important, isn't it, doctor? Can you explain a little bit more about autism and the management?
Yes, sir. Actually, in autism, what I found now, sir, usually we have a tendency for like these kids usually head bangs or injures themselves and all. So as homeopaths, we have a tendency to go behind that rubrics of head banging and monosyllables, using monosyllables, because that is but common symptoms. That are common symptoms. So we have to avoid all those things, because that is common symptom of autism. Hahnemann told us to avoid all the common symptoms of the disease. So these symptoms help us only for the diagnosis of the disease, because they are poor in communication and they use repetitive behaviors, and when they found difficulty to express what they need and all, they used to hurt others and they hurt themselves. So that kind of symptoms we have to avoid completely, and we have to focus on the individual, so as a whole, and we have to go for the general symptoms that we will get definitely, because we will have confusion that if the child is completely mute, how can we get all these symptoms from the patient, because he is not responding to us, he is not making eye contact, he is running there and here and there, then how can we get all these symptoms? That is a common confusion. But see, in all cases, as Hahnemann said, we have to be careful in observation. In between the other persons. So usually it is not with the this autistic kids, because they avoid crowd and they are very violent, or they get disturbed when they see new persons, or when new person enters their house, or any change in circumstances or surroundings, they will be disturbed. But in the case of phosphorus, usually like an ink dropped in a glass of water. So it will be mixed in between others, no? So he'll be in and around others. So that helped me in selection. Similarly, one other child, when I asked about the parents, I usually ask them like what they like to eat. Because the parents may say that he will eat whatever we give and he won't be having any preference, he won't tell no. But we have to ask, when we give something, which food he eats without any hesitation or without any force, which he likes to eat. Whether it is sweet, sour, spicy, or something like that.
Yes, Dr. Bindu, excuse me, Dr. Bindu, Mr. Ranjit is ready to talk with you.
Okay.
Yeah. Dr. Ranjit Thomas, yes, you can speak. Some technical problem. Doctor, you are not audible.
Can't hear you, sir.
I think you can rejoin once again so that
Second,
Oh.
again, yeah. And now, you please speak.
yes.
Can you hear me now?
Yeah, now it's okay.
Yeah, sir, please.
Okay. I'm having an ADHD patient. She used to come for me for the last 6 months. She's consulting me. LKG student. The thing is that I have given her Natramur on the basis of hyperactivity and all, but then there is no result actually. The particular peculiarity of her I noted is she want to jump from heights. She want to jump from heights. She want to run around, and there is a lot of this one. Eye contact is not there. Can you help me with her case? Do you have any suggestion of medicines?
Sir, here also, you know that what made you think of Netamur? You told me that she was jumping around and she was running around. That is a common symptom of ADHD. So, an ADHD child will not sit. He or she will roam around our clinic, taking this and that, and they will not. They will jump around the furnitures and also that is a common symptom of ADHD. So you have to avoid all those symptoms which point to that lack of attention and not keeping eye contact, not listening to what we are saying. All those symptoms are common symptoms of ADHD. So you have to avoid all those things and take the history of the mother also. Like during her pregnancy stage, what was the condition of the mother? Whether she was on any medicine, whether she was undergone any stress, or what was the kind of delivery, whether it was a normal or a forceps delivery, was she, that child, whether the child had breastfed, if so, how long she was breastfed, and whether she was kept, she or the child was kept away from the parents, whether the child was kept in ICU, and if so, how long. All these things will help us in the selection of medicine. Don't go behind the common symptoms of ADHD, sir. We all make mistakes, no? I am lucky that I am an organon teacher and lucky that I got PGs like Manoj sir and Srividya madam, Bodhi sir and all that they have inspired me a lot. I will like, especially I would like to mention Dr. Srividya. So she's one of the person who helped me a lot. I followed her and none other than Dr. Ajay Kumar Babu. So if I don't mention their name, it will not be good. So sir, try to avoid all those common symptoms and Manu Varghese also, sorry. And don't go behind that common symptoms which help us in diagnosis of this condition. Try to get something like, ask the parent, like when she is getting disturbed, what makes her sad? If she is sad, what will she do? Whether she irritates, or what will be her attitude, and how she sleeps, in which position, and if she takes a glass of water, how much she will drink, and all those details, that particular, like that points which help us in individualizing will help us find the remedy, sir. So please go through the case, and if you need any help, you are free to call me, sir, at any time.
Today, when her parent came to me today, and he was telling me that when she used to give her a list for buying something, if he forgets to bring things, she will slap him. The girl used to slap him like that is paining, like that he was telling me. She used
that
to
too
slap.
don't help, sir. More details needed, sir.
Yeah. Okay.
We'll help you, sir. Please give me a call when you are free.
Thank you, doctor. Thank you. Thanks a lot. Thank you, Dr. Injit Thomas, for the question. And next is Mr. Ahmad Hassan. Dr. Ahmad Hassan, please.
Respected Madam Dr. Bindu, thank you very much. I am from Saudi Arabia. My neighbor, he is poor man, Yemeni national. His children, his one child, all child is okay. One child is, so is it possible? Your help from India to Saudi Arabia? Consultation or any advice?
Having few patients from Dubai and few from UK and US and all. We will discuss, sir. Please give me a call when you are free. We will discuss how it is possible for us to reach him.
Thank you very much. Thank you, madam.
Thank you, Hans. 1 or 2 minutes only, but I need to ask you another thing. Usually it's being thought that these autistic cases are the results of these cobivalent vaccines, and these vaccines, after 1.5 years or something like that, the child, which is very normal in its growth, suddenly is slipping to this autistic mode, and we are thinking that it is due to the misuse of this type of vaccines. And is there any use in giving some medicines like Tuja or something, some medicine Silesia or like that to start the case?
Sir,
Or do we
actually,
think
I was while I was doing PG, you know that due to like in the PG work, I went through all these articles. So at the beginning, I too felt that it is because of this vaccination, especially MMR vaccination, the child is going back or regressive. But later, when I went into the depth of the autism, I understood that usually autistic child, like they will manifest, especially this regressive kind of autism, they manifest only at the age of 1.5 or 2 years. So that is a common thing, nothing to relate with the MMR vaccine and all. As like there are studies supporting and not supporting, because we can't say that it is the cause. It is definitely a cause, but it can contribute that in a way that we can say that it can contribute. Usually the child, we see that in 1.5 or 2 years, the child will slowly goes into his or her own world and play himself or herself, and will stop talking to others and all, spinning and walking and all. It begins at the age of 1.5 to 2 years. It is common with the regressive kind of autism. So we will always confuse, because at that age only we will take the child for MMR vaccination. So at 1.5 years we give the vaccine, and we know that MMR is mumps, rubella, and measles. All of these have neuro complications, and also definitely we will think like that only. But I don't think.
Thank you. And it's a matter of controversy, I know. And so the rightly selected medicine itself is the medicine for the case, isn't it? Like that?
True. True, sir.
Okay.
True.
Thank you.